The United States is hitting the pause button on Johnson & Johnson's COVID-19 vaccine.
That's after 6 women experienced blood clotting after being administered the vaccine. One of those has died.
Brett Vetter has reaction from health officials and what you need to know if you got the Johnson & Johnson vaccine.
Just as the vaccine rollout picks up speed across the country, things have come to a grinding halt for Johnson & Johnson's popular single-dose vaccine.
And we have 1,000 doses plus in a refrigerator. So this news is really not very welcome to me.
It's a frustrating time for MSU Medical Director Dr. Keith Williamson, who says the university's remaining doses of Johnson & Johnson vaccine will be kept safely on campus until they are ready to be administered.
The vaccine is stable if properly cared for, and ours is till the end of June. That this will be fleshed out, understood, and any safety precautions that need to be taken will be described by the next 2 weeks easily.
During that time, scientists at the FDA and CDC will jointly study the vaccine to figure out whether there is a connection between the drug and blood clotting experienced by 6 people.
It seems to be likely that this is an autoimmune response that triggers on the combination of the vaccine and a very rare protein called PF4, platelet factor 4, which is uncommon.
A number that pales in comparison to the nearly 7 million Americans that have already received the vaccine, which is why Wichita County Health Director Lou Kreidler says those who have already received the vaccine shouldn't panic.
Incidence is very, very, very low, and I really think that the CDC and FDA have pulled the J&J temporarily out of an abundance of caution.
Caution that Dr. Williamson says shouldn't keep anyone from getting the other vaccines.
It would be alarming if a meteorite hit my car, but it's not very likely. The same with this, the likelihood is so very low, there's no place for anxiety or losing sleep about it.
Taking everything into perspective as Americans continue to roll up their sleeve for a vaccine. Brett Vetter, KFDX News.
Dr. Williamson says Americans who have already received the vaccine should continue to monitor their symptoms and contact a physician if you experience a severe headache or pain and swelling in your legs.
Well, there are still a number of places offering the Moderna and Pfizer vaccine around Wichita Falls. Market Street pharmacies offering the Pfizer vaccine, and Walmart pharmacies on Greenbrier and Central East Freeway are still in stock with either Pfizer or Moderna. Also, United Pharmacy in Burke-Burnett offers the Moderna shots.
And don't forget, MSU is doing a month-long vaccine clinic every Tuesday and Thursday this month. You'll want to call the location beforehand and see which vaccine that they have in supply before you get yours. For a full list of locations offering a COVID vaccine, just head over to Texomashomepage.com.